So next we have Shelley Horak. Is it Horak?
Horak, yep.
All right, Shelley Horak. She'll be talking about the transportation and the connection of mental health, increasing equity for that. So I will turn it over to her. If you have any questions, go ahead and put them in the chat, and we will make sure to address them in the end. All right, it's all you, Shelley. Thanks for joining us.
Okay. All right. Well, thanks for having me. I'm honored to be presenting today. Public transportation, as you all know, is an essential element in creating vibrant communities. So today, we're going to take this one step further and explore how transportation is essential to the well-being and quality of life for two populations. It's important that you know that I do not consider myself a transportation expert. I am a fan, I am a champion, and a supporter of the important and challenging work that you all do. I hope today that you'll hear one thing that inspires and validates you. So again, thank you for having me. All right, so objectives for the day. Always nice to know where we're going. So today we're going to discuss the role transportation plays in mental health access. We're going to highlight how transportation increases social engagement in older adults. We'll review measures of transportation equity for individuals seeking mental health services in older adults. And then in the end, we'll support investments in public transit as a contributor to quality of life. So a little bit of context, let's just set the stage. So the relevant results of the pandemic to me can be summed up in one word, which is distance. Social distance, physical distance, and emotional distance. We have an increased need to get there since the start of the pandemic, and getting there looks like taking back our social, physical, and emotional well-being. So that I think is foundational for our discussion today. There may have been times in the past 2 years where you felt lonely. Your neighbors have all had these feelings as well. Authors remind us of the importance of addressing loneliness. We can feel socially lonely when we have fewer relationships than we would like. We can feel emotionally lonely when we lack the ability to share our fears, our sorrows, and our joys. In addition, positive emotions are not an option. We need them for our health. When we don't have these, the evidence highlights a decline in our outcomes. We become ill in many ways when we're lonely. It's not enough to have virtual or electronic connections. Face-to-face is still the preferred method, the one preferred by your body and your mind. Just make sure that I didn't advance too many. Okay, when we're isolated, our risk for mortality increases. Social relationships and support reduce despair and enhance the way we address the inevitable changes we encounter throughout our lives. We need to identify with a purpose. We need to belong, to be secure, to feel worthy. Social relationships are inextricable from discussions around health and well-being. Medical improvements and healthy behaviors are not enough on their own. It all comes back to connection. If relationships and face-to-face connection are what is important to our well-being, then in my mind, transportation is the how. Each trip has a purpose and each purpose has a connection. There's something waiting for us at the end of that trip. And more than likely, it's a face-to-face connection with another human being. So on the slide, you see that logic. Transportation is how we connect. We get there by multiple different kinds of means, and we glean value from our trips, social value. I liked how this author put it, the results of this study put this in a little bit more detail. This author found the frequency of walking affects social satisfaction. The frequency of cycling affects the number of social interactions, and car ownership affects loneliness. So I'll just go back to the pandemic. In the pandemic, if I would go on a walk and I saw other people, I would feel happy that there were other people out there, and it reminds me that I was part of a community, and it was somewhat satisfying, although we didn't know how to navigate the space on the sidewalk, right? But it was great to see that other people were still out and about with me. Frequency of cycling affecting the number of social interactions. Cycling is just a little bit faster. We can go a little bit farther. But as a reluctant bike culture person, I would say even during the pandemic and when things started to open up just a little bit, I knew that at the end of whatever ride I had, or maybe I was going with other people, it was safe to be around other people and have the interaction and talk and share. And so definitely the study wasn't conducted during that time, but it definitely felt true to my experience. And then car ownership affects loneliness. I thought this result of this study was like just struck home with me. For folks who, I had somebody at my church say, "Hey, Shelley, did you know there are people in our community that don't have cars?" And I said, yes, that is true, but it was a surprise. It's a surprise to others when someone doesn't have a vehicle, or and then I think the natural thing to wonder is, how are they doing? Because it's easy for me to get to places where people are and I don't have to feel alone or lonely. And so car ownership is a very big deal, but just liked the way that well-being was portrayed in this way. So I wanted to take a little bit of time to share what I found when I explored the literature on transportation and its connection to individuals seeking mental health services. So just a little bit more in-depth context. So here is the data related to the prevalence of mental illness in the United States. So this was prevalence of any mental illness in 2020. So in the US, in that year, there were an estimated 52.9 million adults aged 18 or older with any mental illness. That number represented 21% of all US adults. The prevalence of any mental illness was higher among females than males. Young adults had the highest prevalence, those aged 18 to 25 compared to those aged 26 to 49, followed by those 50 and older. The prevalence of any mental illness was highest among the adults reporting 2 or more races, followed by white adults, and the prevalence of any mental illness was lowest among Asian adults. In 2020, among the 52.9 million adults with any mental illness, 24.3 million, or just over 46%, received mental health services within the past year. So while the pandemic may have had an impact on the number of adults needing and accessing services during this year, some of them access services through telehealth, the information is still compelling. Just under half of those in need receive services. When individuals in need miss mental health appointments, the results are more than just disappointing. They can be devastating, especially for those with long-term conditions. While not having transportation was reported as the least of the reasons for missing appointments in study 2, it was still significant. 24.3 million people received services in 2020 per our previous slide. So I wanted to do the math. If those individuals missed appointments at the rate shown here, 4.8% due to transportation barriers, then nearly 1.2 million people missed an appointment for that reason. If their conditions were chronic and they missed 2 or more appointments, they could have been subject to the increased mortality suggested here, which was an 8-fold increase in the risk of all-cause mortality. The math is not completely accurate, and it is not the whole story, but it provides some context for our discussion. Transportation is highly connected to the well-being of individuals who are seeking mental health services and their longevity. The authors for this study, they studied 211 requests for transportation assistance and made the correlation between those with a mental health condition and requests for transportation assistance. So the study population were low-income smokers identifying as having a mental health condition. They were twice as likely to request transportation assistance as those without a mental health condition. Individuals with PTSD, bipolar disorder, drug or alcohol use disorder, and ADHD were found to be the most frequent requesters. Requests were higher among white participants, those living in rural areas, and those not employed outside the home. So these results suggest that non-white individuals, those living in urban areas, and those employed outside the home were not requesting assistance at the same rate, which inspires a whole different line of questioning. Why is this? And I'm guessing there are multiple answers. In the end, the lack of transportation negatively affects independence, autonomy, and access to treatment. So while this was a pretty brief review of the literature, there's plenty out there. It does suggest these three outcomes for individuals seeking mental health services who have barriers to transportation: a loss of independence, decreased access to treatment, and increased mortality. So, second phase. I also reviewed the literature related to older adults and transportation. This population is growing, and there are a significant number of older adults living alone and in poverty. Many report their health is not optimal and their independence is declining. Their reliance on social connection within and outside their groups increases over time. Transportation is how connection happens. So let's just review the data. The population increased by a little over 34% since 2010. It increased by just 3.2% in 1 year between 2018 and 2019, moving our national median age up by 1.2 years. So the national median age is now 38.4 years. 27% of all older adults 65 and over live alone. That's 14.7 million people over the age of 65 living alone. And that increases exponentially to 42% for those who are 75 and older living alone. Median income for older persons was $27,398 a year. In 2019, 8.9% lived below the poverty line. In 2019, 22.3% of those aged 65 to 74 considered their health to be fair or poor, which I find the most probably compelling argument on this slide. Among those over 75, this rating was roughly 30%. So that to me is unfortunate and something we need to address. So 19% of adults over 65 advised they could not function at all or had a lot of difficulty with at least one of the 6 functioning domains: seeing, hearing, mobility, cognition, and self-care. So you can see that the circumstances experienced by our older citizens indeed deserve our attention. So let's talk a little bit about quality of life. The very first bullet on here, our orange rectangle, indicates what I thought was a very interesting point made by the U.S. Department of Transportation. They advise that simply looking at the cost of a home was not enough, or housing costs was not enough to really understand what it means for folks to live on their own and the cost of living. So they advise that transportation costs are essential to telling the whole story about economic stresses experienced by older adults, which has an impact on how they experience life. Social life, relationships, and activity, along with income, contribute to a positive quality of life. And when those things start to erode, our quality, our health also erodes. As we age, driving or our inability to drive reveals itself as a contributor to our quality of life based on the limitation, our limitation to connect with other people, our social connections decreasing. So a little bit of a more complicated discussion, but same premise. When we are unable to connect over time, it impacts our health and it impacts our quality of life. So the information presented on this slide offers further support for transportation's connection to quality of life for older adults. The evidence here is clear that the loss of mobility over the course of our lives places us in a position to be more socially isolated, lonely, and disconnected from the services and supports needed to be well. I think it's important to take a look at, I think research and the literature often validate what I believe I know, or what I think I know anecdotally. And so what I appreciated about this investigation, that it was definitely not out of the question to say, when we lose our ability to move around, that we become isolated, lonely, and disconnected, and our health declines. That is a fact. It is not something we're making up. On the bright side, public transportation is noted as an option to maintaining our physical, social, and mental health. Also, not a made-up story. So, appreciated these authors and organizations in putting that information out there for us to digest. So this brief review of the literature for older adults highlights these consequences for those who have transportation challenges. So a lack of transportation results in loss of independence, increased loneliness, and decreased access to care and overall health. So where I landed after all of that was really on equity. And equity is more than a buzzword, although the more often we say it, the more often it seems like a buzzword. Equity is really the hard work of making sure our systems are free from bias or favoritism. The purpose of my discussion on equity today is to highlight how the concept can be applied to transportation and how measuring equity in transportation can reveal the realities of the experiences of people who are seeking mental health services and older adults. So here's a story as I see it. Those who cannot, should not, or prefer not to drive have a higher potential for diminished connection, negatively impacting well-being and quality of life. When individuals in these groups, this is not equitable. When individuals in these groups can't get there, there are many losses to be counted. So the solution: removing barriers experienced by those who cannot, should not, or prefer not to drive, ensures increased social connection, well-being, and quality of life. Understanding transportation equity can guide us toward improvement. So, transportation equity. This is the work of Littman. This work has been published several times over the last several years in multiple publications. I am citing it as 2022, but I also found it with other years associated with it, but it didn't matter to me because I thought that this framework was clarifying. It clarified the concept of transportation equity for me in a way that other frameworks have not. And it made me want to test it. Is it real? Does it work? Littman advises the following. Equity refers to the fairness with which impacts, benefits, or costs are distributed. Transportation planning decisions often have significant equity impacts. Transportation equity analysis is difficult because there's so many types of equity. many potential impacts to consider, various ways to measure those impacts, and many possible ways to categorize people. This report provides practical guidance for evaluating transportation equity. It defines various types of equity and equity impacts and describes practical ways to incorporate equity evaluation and objectives into transportation planning. So horizontal equity is defined by Littman as people with similar needs and abilities are treated similarly. Vertical equity is defined as disadvantaged people should receive favorable treatment. So under horizontal equity, we have a fair share of resources. People should get what they pay for and pay for what they get, unless subsidies are specifically justified. External costs, under horizontal equity, those are costs that travel activities impose on other people, such as the delay, risk, and pollution. Those are unfair, and impact should be minimized or compensated. Inclusivity, vertical equity with regard to need and ability. This considers how transportation systems serve people with disabilities, youth and seniors, and other special mobility needs. This justifies multimodal planning and universal design requirements. Affordability. This is vertical equity with regard to income. This considers how transportation systems affect lower income people. Policies that favor lower income people are called progressive, and those that favor higher income people are called regressive. This justifies policies that improve affordable modes and subsidize low income travelers. And then the final category of vertical equity is social justice. This considers how transportation systems serve disadvantaged and underserved groups and address structural injustices such as racism and sexism. So that sets the stage. And then I thought I'd take it one step further. So our author advises equity analysis can consider various types, impacts, and metrics and groups. So the author didn't really say this is the way you do it. So I wanted to figure out how. He also advised that mobility-based evaluation results in a focus on fast, long trips, meaning roadway expansions. Accessibility-based evaluation results in a focus on the impacts or costs that wider roads and higher speeds have on those who are walking and bicycling. So accessibility-based evaluation considers people who cannot, should not, or prefer not to drive. So to test this framework, I suggested asking and answering key questions in each category. So under a fair share of resources, I propose to myself, what are they paying for? What do they receive? Is mobility increased or accessibility increased? Under external costs, what destinations are most accessible and what are still out of reach? What additional costs are present, stigma, time, etc. Under inclusivity, what modes of transportation are available, what modes are not available, accessible, or affordable, what needs are met and what needs are not met by those modes. And then under affordability, what is the cost burden? Under social justice, what formal or informal policies or programs support or limit mobility and accessibility? Are there populations or subpopulations that have more or fewer options? What barriers exist? What supports exist? So lots of questions. Let's explore what happened next. So I thought it would be great to see how some of these questions worked and what it looked like to reveal how the two populations I shared with you earlier experience transportation equity. So I developed a survey and distributed it to teams and stakeholders that I knew. So I asked 13 total questions. I had 128 responses, which I thought was pretty great, from our mental health and disability services regions and area agencies on aging. The questions that I developed were according to Littman's categories of transportation equity, as you saw. So this is how they answered. I did ask the equity-based questions along with some contextual questions. I needed some sort of some foundation. So the basics are shown on this slide, and I'll get into a little bit more detail momentarily. 0 to 25% of the populations represented were licensed drivers. Someone else drives, and public transportation were the key resources. Also, over half biked or walked, and just as many had no reliable means of transportation at all. The types of trips most needed were health appointments, shopping, work, and other errands. Not rocket science, probably what you'd expect, but again, validated what I thought I might only be assuming. So some of the questions I quantified, and so you can see here the numbers associated with what I mentioned before. About 56% of the respondents stated 0 to 25% of their clients were licensed drivers. For those who didn't drive, the vast majority, 84%, someone else drives. Public transportation was next, and then biking, walking, and no reliable means of transportation. Modes that were not available included taxi, public transportation, drive own vehicle, and use someone else's vehicle. And then 47% of the respondents advised their clients needed assistance from other sources to get around 75 to 100% of the time. The types of trips needed most were health appointments, shopping, work, and other errands. And 90% of the survey respondents advised cost was a barrier for their clients. It's always good to have a qualitative review associated with the quantitative. So destinations that were out of reach, and I have only listed just a snippet, but parks, employment, trips over 1 hour, community resources, dental providers, courts, rural locations, therapists, medication managers, out-of-town trips, mostly out-of-town trips. How much is too much? That was all over the map as well, but the most common responses were any cost, $2, $5, and $10. And so basic needs budgets in the end were noted to have a low tolerance for transportation costs. What formal or informal policies or programs support mobility for this population in your location? Volunteer drivers, Uber, Lyft, regional transportation, county funding, program-sponsored rides, NEMT coaches and job coaches, and family and friends. And then some additional thoughts. People shared a few anecdotal stories, basically. They miss medical appointments, don't receive proper medical attention, and suffer extreme isolation. Transportation from rural towns into urban areas where doctors are located is a big issue. Transportation is the biggest barrier in helping people find jobs. The taxi is not wheelchair accessible and no assistance getting in and out of the vehicle. The trolley can be costly and has limited availability. Rural areas, rural residents tend to be left behind and further disadvantaged by the inequity in access to transportation. There's a push-pull effect for the migration of population from rural locations to the more urban areas. And so this isn't anything new to you, and it isn't anything that we haven't tried in the past or are trying now to resolve. It simply is. These are just what is. And I would say solving transportation issues becomes one of those, and I'll call it a wicked problem, right? So we have a lot of need, and there are solutions, but putting them in place is the most challenging. And when I said equity earlier, somebody actually asked me, how do you do equity? Well, it's challenging. It's hard work, and there are no easy answers. So this is what equity looked like when I compared, when I just finished out the table, right? So for a fair share of resources on horizontal equity, 47% of the respondents advised their clients needed assistance from other sources to get around 75 to 100% of the time. So was their mobility increased or accessibility increased for for half of the respondents and their clients, it didn't look like it. External costs, what destinations were still out of reach, and I read you that list before, and so there were still plenty of destinations that were out of reach. I did not ask the question about additional costs that were present, such as stigma, time, etc., but would recommend adding that later. This is what vertical equity looked like in inclusivity. What modes were not available, accessible, or affordable, what needs were not met. Modes that were not available included, as I said before, taxi, public transportation, drive-on vehicle, use someone else's vehicle. The cost burden, we went over also under affordability, 90% advised cost was a barrier in those ranges. And then under social justice, what formal or informal policies or programs support or limit mobility and accessibility? Are there populations or subpopulations that have more or fewer options? And so the stories. And so I wouldn't have scored anything in the green category, but I guess I didn't expect to. I think it is easier in some cases to talk about, and this happens all the time in my day job. It's easier to talk about the problem than it is to talk about the solutions. But I think considering the problem in a framework like this could be helpful. So the main question you have probably, and the question I had was, so what? Again, equity is hard to measure and it's harder to do. And we are talking about folks seeking mental health services and older adults. And so I can make a few suggestions, but look forward to the dialogue when I reach the end. So the story is this. Individuals with mental health conditions and those who are aging rely on transportation for social connection, well-being, and quality of life. When transportation options are limited, they experience a loss of independence, decreased access to care, increased loneliness, increased mortality. The transportation equity framework can guide our assessment of these challenges and inspire decision-making and innovation. The most recent pilot of a survey using this framework revealed baseline information citing deficits in horizontal and vertical equity for these groups. Investments in transportation should address these inequities. The result will be increased social connection, well-being, and quality of life. So full circle. This is the main takeaway. It's nothing new, but definitely backed by evidence and supported by data. When we invest in transportation, we invest in well-being, we invest in equity, and we increase our quality of life. So what do I propose? Some very basic action steps. The word I believe that is most important on this slide is standardize. In my research for this presentation, I found many equity surveys and a ton of community and stakeholder engagement, lots of information out there. People are doing a great job of gathering information. What I didn't find is a standardized set of questions that everyone asked. That limited my ability to compare things, compare results, and minimize my ability to support what I know to be true with the facts. So this is also true about formal and informal policies that address limitations for disadvantaged populations. While I understand differences, and we all understand differences within each community, they demand different strategies. It would have been great to see suggested options repeated. And again, I am a champion and a supporter, not an expert. And so that was my frame of reference, which it could be. As a non-expert, repetition and standardization are needed to drive people like me toward the most appropriate opportunities for improvement. So if you have a community leader in my community looking through the vast amount of information, where can they land on solid ground in making decisions? So I suggested standardizing continuous and targeted measurement of transportation equity, creating and proposing formal and informal policies that address limitations for key populations. What's the package that's most important? And then finally, well-being and quality of life are highly connected to transportation in the literature. They were not as highly touted beyond research. And so these are really compelling arguments for investment. Well-being and quality of life should be promoted as core values and outcomes for transportation. And it could be that we believe they are. But again, in the multiple tabs and multiple documents and synthesis that I tried to do, I didn't see those two themes coming through in the preponderance I would have liked. So they may be good opportunities for promoting investments in transportation. I also came up with other ideas, and these are Shelley Horak based ideas, and they may exist, but again, I didn't find them. Identifying the locations of highest need. When I looked at the survey results and people saying, well, out of town trips were the hardest and probably in my mind the most expensive, and affordability is a challenge. Where are those locations that people are needing to get to most often? Are they the same? Are they very different? And more investigation would be needed, but maps often in my mind are the best way to get people to ask better questions. And if we're mapping the locations that people need most often, can we start to ask better questions about why they're not getting there? Because if we have to start somewhere, start with the where the need is. Increasing the number and availability of those options would be a place to start. Prioritizing work and healthcare trips is really important. That came through in the survey. But I would also say that we shouldn't set aside supporting social trips just because I want to go, just because I feel like I need to see someone today. In our church community, and when we have fellowship, we didn't have fellowship for a while, and the vast majority of folks they're just so grateful for that time to sit together, and they're already out and about. So my guess is that they're not getting a lot of additional trips throughout the week. Address the cost burden and add an assessment of ancillary costs such as stigma, dependence, and opportunity costs, like how people are making trade-offs to go places. Support innovation in rural transportation. Increase the number of volunteer and low-cost ride programs, build rural bike share programs, and incentivize walkable community design. In my community, I feel a bike share program would be so helpful, more helpful than people know now or can guess. And then incentivizing walkable community design. Rural communities are also trying to grow, and they're creating new neighborhoods and things. In my community specifically, through no fault of anyone's, we have plans for subdivisions and growth, and we're super excited about it, but everybody's walking on the roads. We don't have sidewalks. And where we do have sidewalks, the infrastructure isn't as great as we'd like. So I think just making sure that when we're designing communities that we think about active transportation. So that is what I have for you today. So I'd like to stop sharing and have you chime in with questions and dialogue. I am open to your feedback.
So Shelley, Danny, are you going to do the chat?
Yeah, I was just going to go ahead and read the few things we have here.
Okay.
Abigail says, perceived health status stratified by age trends similar to that of income. How do you think these influence each other? Would you consider access to transportation a protective factor that improved perceived health status among older adults?
Yeah, honestly, Abigail, that's what the literature alludes to, and that's what I would anticipate to be true. that loss of mobility over time, or due to our economic circumstances, any number of issues, the loss of transportation just further, what I want to say, negatively impacts our health and our well-being. I hope that answers your question.
Jeremy Johnson Miller says, thanks, Shelley, for the NADTC shout out on the transportation needs for older adults. And then he put a link to the 2018 report. Brooke Ramsey said, such great food for thought on ways transportation can communicate with our services, what our services do for the community. Also great information for community partners when people can't get to a service they are lacking access and quality of life. Sheila Holbrook White says, great presentation. Thank you so much for your rigor and your focus on this critical topic. Michael asks, how would you recommend conducting a survey to the elderly and disabled within paratransit?
You know, I sit in a position sort of of privilege in that way. I'm not boots on the ground. And so I enlist my my DHS partners and Department on Aging partners. I do think that advocacy organizations, working with advocacy organizations and suggesting, and I do think advocacy organizations have taken into consideration transportation. I was just in a meeting before this one where we were talking about older adults and loneliness, and not related to transportation, but it naturally came up in conversation. So I think it would just be suggesting, hey, this information would be really helpful. Can you help us distribute it? And then how do we reach folks who may not have an electronic means to interact with the survey? How do we get this in the hands of people so paper surveys can still be a thing? But I think we need to meet people where they're at. Also about the survey, I did ask a few questions that I didn't think worked very well. So of course I didn't report them today. But I would recommend tweaking those questions. And if you're interested in the questions I asked or my survey, I would definitely be willing to share that. There's no need also to recreate the wheel on asking questions. And, you know, if a question doesn't work for you and you want to tweak it for, you know, your audience, I think that's totally doable, and I definitely support that. So if you want the survey questions or the methodology or any of these resources, please let me know. I'll definitely share.
And Shelley, we could, oh, sorry.
To piggyback on that, I just wanted to say one of the biggest things is just leaning on your partners. And, you know, as I was talking to Shelley before this and just said, you know, if you want us to share the survey out, we definitely can. Just making sure, you know, we're all trying to, you know, solve these, you know, break down these barriers. So just whatever we can to help each other out. And, you know, and Jeremy Johnson Miller's on this chat. You know, we share things for him. He shares things for us. So just getting that out there and kind of, and like Shelley said, meeting them where they're at too, you know, having volunteers call for survey responses, putting it on your website, also doing paper surveys for people, setting up a survey on like a tablet and just, you know, going and asking people to fill out the survey that way. So,
yeah, definitely.
Shelley, one of the things I was going to say is because we noticed that several people dropped off of the, you know, and we told people they can come and go as they want. And so we were trying to be like, oh, why wouldn't somebody want that? To, you know, to listen to the mental health and public transportation. But I think sometimes when we just put that out there, like mental health and transportation, they only think of it as us taking people to a mental health appointment or those types of things. So we need to find a way to kind of change that narrative, that it's that socialization, it's the getting people out of the house, it's getting them to not just mental health care, but any kind of health care, or getting them to the nursing home to visit their husband, or all of those things that, you know, transportation does. But anytime we put mental health and public transportation, people tend to think, oh, it's just going to talk about how do we get more people to that appointment. And it's so much more than that. So just kind of throwing that out there because I'm not exactly sure how to do that, but I think that's something we really need to talk about and change that narrative.
Yeah, I believe so. I mean, I think so. I shared because I thought it was a compelling argument about the missed appointments, but I mean, we're also missing other things, right? When we don't go see our friends or we don't, we're not feeling that great that day and we maybe just need to be at Walmart, and know that we're part of a bigger place. Or we want to go out to eat. Going out to eat is a social activity and it's a boost. It's a mental health boost. And so I think transportation and like I shared the information about any mental illness. I mean, how many of us don't fit into that category at any given moment throughout the year, throughout our lives? How many of us won't struggle? So I think, changing the narrative is really important, Julia. This was really fun. I learned a lot doing this, and I was so glad to be asked. If, again, please reach out to me. I know Julia shared, I think, my email address. I'm open to all kinds of dialogue. I'm all about having coffee. And we can do that virtually or together. I'm all right with that. But please do reach out. I'd love to chat with you. I run a social determinants of health stakeholder work group, and we meet once a month. If you're interested in bringing the conversation about transportation there, Jeremy's been engaged in that before. And I think we need to keep having the conversation. Like I said this morning, we were talking about aging and it just rolled right towards transportation and loneliness. So.
Great point. Well, you'll definitely be hearing from us more.
Oh, good. Yay.
Danny, there's a couple more comments in the chat.
Yep. Jeremy says, when approaching groups to be part of the survey, ask them what format they prefer to use. You can perform focus groups, onboard surveys, but also ensure your digital documents are ADA compliant and have the ability to be read by a screen reader that some in the disability community might need to read your survey. And then Moises said, thank you, Shelley. It was an eye-opening presentation. I rarely think about how transportation plays a role on not only getting us from point A to point B, but also health-wise and well-being. Brenda says, thank you, Shelley. Great information. And I believe we sometimes get so involved and lose sight of these things.
I appreciate that. And I'm, like I said, I was super honored to be here and very supportive of the work you're all doing. So thanks a lot.